Hello, and welcome to Healthcare Professionals in Social Media, the story so far from Creation Pinpoint. My name is Daniel Jin, and I'm the founder and CEO of Creation Healthcare. Creation Pinpoint is the world's first ever tool dedicated to studying conversations between healthcare professionals in public social media environments. It's produced by Creation Healthcare, the research and training consultancy for the digital healthcare age, which has been studying the digital behaviors of healthcare stakeholders like patients, physicians, and healthcare providers for over 15 years. Now, to give you some background on Creation Pinpoint, in recent years, we have seen a significant growth in the rate at which healthcare professionals are using public social media channels to discuss clinical and practice matters. In fact, in 2012, this seemed to reach a kind of tipping point with a critical mass of healthcare professionals online. But among all the digital research tools that we were using at Creation Healthcare, there was no tool available that would accurately study what these healthcare professionals were saying or doing in social media. So we designed and built one. We created the world's only tool dedicated to researching public social media conversations between healthcare professionals. That tool is Creation Pinpoint. Creation Pinpoint distills the collective knowledge of doctors all over the world who are using public social media channels and makes that knowledge available as a live online dashboard, or as email alerts, or as beautiful reports that can be used by anybody who wants to learn what doctors are saying about a particular topic. That might be for other doctors, it might be healthcare providers, or it might be healthcare companies. So let's take a look back over recent years at some of the things that we've seen that told us just how important social media has become for healthcare professionals. In 2010, I was speaking at the mHealth conference in Dubai alongside other experts in digital health. At this conference, there was a panel discussion with healthcare professionals, and I was struck by this particular comment made by a UK-based doctor addressing the pharmaceutical industry. What he said was, "Why should I see your pharma rep when I can learn more from Wikipedia than he's even allowed to tell me?" And there was a real sense here that information shared by other people on the internet was valuable to doctors and gave them a freedom to find the information they wanted, where and when they wanted it. And then, in 2011, the Journal of Medical Internet Research carried out a survey on social media use among a random sample of around 1,700 practicing oncologists and primary care physicians in the United States. 61% of those who responded said that they scan or explore medical information via social media, and 46% said that they contribute to new information. So there's a sense here, way back in 2011, that in the US at least, social media was playing an important role already in doctors accessing and sharing medical information. Now let's skip forward to 2012, and in the UK, the General Medical Council, which regulates doctors, issued draft guidance because it realised that doctors were increasingly using public social media channels. The guidance pointed out to doctors that, as well as potential benefits to patients, the use of social media can benefit your professional relationships with colleagues, as you see in this extract. And then shortly afterwards, the Medical Protection Society, which works with healthcare professionals in the UK, carried out a survey among 1,250 members and found that 68% of them were on Facebook, with 73% of those using it every week and over half of them using it daily. A smaller number, as you see here, were on Twitter at that stage. And around the same time as all this was happening, mid-2012, at the International Conference on Emergency Medicine in Dublin, Ireland, Mike Cadigan, an emergency physician based in Australia, presented to his peers the FOAMed and FOAM Twitter chat, a collaborative global education initiative among physicians learning from each other in real time, even sometimes in emergency situations via tweets. One of the attractions to physicians taking part in FOMED discussions was the freedom to learn from each other via Twitter without industry sponsorship, as you can see in the quotes here from his talk. Then later that same year, in 2012, an update on US physicians on Twitter was produced by WCG. They ran an initiative which they called Digital Life. It's a database of US physicians on Twitter. In a study they carried out with Kaiser Permanente among 1,400 US healthcare professionals, they found some really interesting behavioral trends and a suggestion that most of these were in fact active beyond Twitter. We see that, for example, 80% of them include a link to another site or platform in their Twitter bio. The Digital Life study was interesting, but it represented a drop in the ocean when it came to the vast number of healthcare professionals worldwide using social media, not only on Twitter, but on blogs, on open forums, and on other open networks. So when we built Creation Pinpoint, we designed it for a digital healthcare age in which millions of healthcare professionals will be using social media. Today, it already has over 110,000 social media profiles covering healthcare professionals all over the world. Let's take a look at what we can learn today from healthcare professionals in social media thanks to Creation Pinpoint. To start with, let's look at some of the physician chats that are taking place on Twitter. In recent months, we've seen a massive increase in Twitter chats used by healthcare professionals, taking place all over the world. We see here the volume of tweets across a few major healthcare professional Twitter chats, and you can see that specialist chats using hashtags like MedEd, which is all about medical education, and FOAM, which is the one that's used mostly by emergency physicians for learning and sharing experiences, are growing fastest. And here we see a global view of people taking part in the MedEd chat. You see that there really are healthcare professionals all over the world taking part. Now, in these kind of chats like MedEd and so on, we do also see non-healthcare professionals taking part, since the chats are open to anybody on Twitter. So let's have a look now at some data on truly distilled healthcare professional only conversations taking place in social media. Let's have a look at a particular disease area, let's say diabetes. This chart is produced using data from Creation Pinpoint and shows the volume of conversations between healthcare professionals during the same 2-month window, January to February, over 3 consecutive years, covering the topics around diabetes. And you can see that the rate of growth is significant. In fact, we see a 235% growth in volume of diabetes-related tweets from healthcare professionals between 2011 and 2013. Now, some people ask us, we know that doctors in the United States are using Twitter, but what about elsewhere? What about Europe, Australia, Japan, and can Creation Pinpoint really tell us about those doctors in those regions? The answer to that is yes. We really do see this taking place worldwide. Here's a map showing volume of tweets in our diabetes study across just Europe within that same data set covering healthcare professionals. The darker areas here show higher volumes, so we see that the UK, Spain, and the Netherlands, for example, are among the most active countries where healthcare professionals are discussing diabetes. And what about outside of Twitter? Well, here's a look at the top 10 most popular blogs, forums, and other sites used by healthcare professionals in our diabetes study. We can see here that the BMJ, the British Medical Journal, accounts for actually over half of mentions among the top 10 non-Twitter sites for healthcare professionals talking about diabetes, with their network, Doc2Doc, and with their blog. We use Creation Pinpoint to take a look at the kinds of topics being discussed by physicians on blogs and forums compared with those topics being discussed on Twitter. And that was quite interesting because what we found was that the most popular topics are not the same in different channels. On Twitter, for example, we see here that kind of more conversational behavior, and we also see organization names mentioned more on Twitter. So in the top word cloud here, we see, for example, Diabetes UK, and we see Sanofi mentioned. These organizations are highly active in engaging healthcare professionals on Twitter, and so they're mentioned in responses and in conversation. So that's a little glimpse of the story so far of healthcare professionals using social media. The question now is, how will this change your future? How would you use insights like these to help you to learn from what doctors do and say in social media? There's a lot more you can discover using Creation Pinpoint, from conversation trends around diseases, indications, therapies, or product mentions, to finding and profiling individual opinion leaders and online influencers among healthcare professionals. Our online dashboard gives you worldwide coverage, tracking millions of conversations taking place among over 100,000 individuals and in tens of thousands of sites, blogs, and forums. And you can choose to receive outputs like email alerts when doctors mention a topic you're interested in, or a fantastic range of beautiful reports with analyzed insights. To find out more about Creation Pinpoint, visit creationpinpoint.com or email info@creationpinpoint.com.